have in front of us, right? Why don't we start with a COVID-19 check-in, as we normally do. Start with some headline numbers, just so that we are all operating off the same facts. As of June 14th, which is today, there are 148,855 total positive cases of COVID-19 in California, okay? 3,092 hospitalizations with 1,000 people in ICU. There have been 5,063 fatalities wide. If you look at the geographic distribution, it's the same story that we've been saying for the past 3 weeks. The high concentration in the Southern California region, and a high concentration in the Bay Area, Sacramento region, Bay Area, and then even the Sacramento region. Okay? Those are the two parts of the state with the highest concentrations. You can see my mouse pointer here pointing. Okay. If we're talking about specifically about Black folks, let's talk about by race. Let's break it down, right? Oh, by the way, I did not get a test this week. I am scheduled for a test 8:45 on Tuesday morning. I went on a hunt for a test this weekend for CVS's and drive-through testing, and every single place did not have any more testing available. And so I'm using one of 4 testing sites here in California, here in Sacramento. I'm specifically using the Cal Expo testing site. I have a test 8:45 a.m. Tuesday morning, and this just.
So how do you feel? Do you feel sick?
I feel sick. I feel like this cough has not left in a week, and I was very bad last week. I'm much better this week, but I know for a fact that when I was out there in those protests, there were people out there who were coughing, sniffling, sneezing, huffing, puffing, scratching, and we was yelling at the top of our lungs and spitting all over each other. It's been about a week since then that I've been in not the best shape. But I feel good. Okay. All right. It's just the cough. Everything else is fine.
Yeah, that's what I meant. Like, do you feel bad now other than the cough? Like, do you feel sick now?
No, I don't. Well, I mean, I feel sick, yeah, but I don't feel like bad, but I can definitely feel sickness. But I'll know for sure this week, okay? And y'all will be the first to know. And yes, the vitamin C, B12, and colloidal silver is on deck, okay? As well as the K, the D. Somebody gave me some Eucerin or something like that. Something as a remedy too. Plus, I'm drinking tea right now, and all kinds of no fever at all.
You do not need to have a fever to have COVID. You can be symptomless. My aunt was tested positive for COVID, and she was symptomless. So fever, you do not need to show or exhibit any symptoms to test positive for COVID, and they're still not sure if you can pass it along if you're symptomless. But you do not need to be showing symptoms to either possibly transmit COVID to another person and to have COVID. You don't have to be showing symptoms. That is a misnomer. So when I got tested, and I'm sorry to cut you off, Chris. When I got tested, people were asking me was I sick or feeling sick? No, I'm at risk. I have asthma, and I catch bronchitis easily. So you can be exposed to the virus unknowingly, and have it transmitted to you and possibly transmit to another person. So I would, I'm telling you, my aunt was tested and she had 0 symptoms and she tested positive. That is a common occurrence. So we have to be aware, and we have to be especially vigilant as Black people, that we can be, we can have the virus. We still don't know what the impact is going to be down the line. That's the problem. They don't know what is going to happen in a few years if you do have the virus in your system. Could it impact your children? Because now they're saying they're finding it in men's semen. That's you know what I'm saying? So I think we need to really be vigilant as Black people, and get ourselves tested, but also ensure social distancing and everything else if you can.
Yes, 100. And I will be on a quarantine no matter what. for the next couple of weeks anyway, as best as I can. I'm already working from home, but I just want to give you guys an update. Next Saturday we'll have a real life answer. Okay, but I did want to let's talk about Black folks though and COVID-19, right? So let's look at the data, right? We're about 4,966 cases here in the state, so about 4.7% of the positive cases. Okay, we're about 6% of the state's population. So in terms of number of cases, we're like less than our population. But there are about 470 deaths, which means that we're about 9.6%, almost 10% of the deaths. Okay, means we're dying more than we should, and we're dying more as a percentage of our population as we welcome in Eve and welcome in also Martine from the Sacramento team. Welcome. So for African Americans, we are 9.6% of the deaths statewide. Okay. So just a status update in terms of where we are as a state. If you're looking to look at these numbers by yourself, I'll put the link in the chat so you can check it out. And then I'm also going to put in another link for you all right here. UCLA, and I want to shout out Tiffany from LA on this. UCLA built a new dashboard that is tracking COVID-19 race-related cases. Because remember, this was a big deal for us for the first couple of months, right? We had no data. We didn't know. I mean, we knew Black people was dying. We just didn't have no official, data. And so now they're trying to fix that. The headline is, and I'm gonna put this link in the chat too. The headline is what we thought it was, and I think we did talk about this last week or not too long ago. 21,000. This is nationwide now. 21,700 Black people have died from COVID-19 complications nationwide. So we lost 20,000 of our people. Okay, that right there is, if you just want to stop right there, 20,000 of us are gone. Okay, in 3 months, right? 20,000 of us. It's a damn shame, right? We make up 13% of the population, but we account for 24% of the deaths where race is known. Okay, so 1 out of every 4 COVID-19 deaths is Black and/or ADOS. All right. This is what the data is telling us officially now. So what we thought was true is true. The worst is true. And now we have what we need in terms of the data to do the kind of advocacy that we need to do. Right. So I just want to point this out. And again, this is nationwide. Just want to make us known, or make this known. Any comments, questions, feedback on any of this?
I wrote up a proposal, and I don't know if ADOS wants to get involved. If not, then I will pass it along to my sorority and to one of the women who works for Biden. She's, I guess, a campaign chair. I can't think of her name right now. Anyhow, I wrote up a proposal about a program that ADOS could lead, since we are, as Black people, most impacted by COVID right now. I actually talked to a friend earlier today in Texas. And Texas is a high impact area, and she had no idea that her area was giving free tests, which, and she had a coworker that tested positive for COVID and has COVID symptoms. I mean, they haven't been at work, but basically the campaign is Know Your Status. It's kind of similar to the way they rolled out the Know Your Status for HIV campaign. If ADOS is willing to lead that, I don't think I could drop it in the chat. It's not under Google, but I can forward the email. The proposal is already written out, and it's basically to make Black people more aware of the myths about COVID, but also to encourage us to get tested and to know our status, because Black people have made complaints that the healthcare system, we are disadvantaged, but we're not taking advantage of these free tests right now. It's not happening. And when I went and got my last test, I've been tested twice. I asked the nurses, who's coming through here, and it's not us. So that is a shame that we are not taking advantage of free tests, and we're not aware that there are free tests out there. Educated Black folks who don't know that there are free tests out there, and we need to really get a hold of that, because this can have devastating impact on our community, not just now, but in the future. But also when we had the pandemic, the Spanish flu in 1918, we were not as impacted by the Spanish flu because we were not integrated with the white community like we are now. And so you know, we were able to overcome the Spanish flu, unlike this current situation. So we really need to be, like I said before, vigilant about it. So I can forward that proposal to you if you like.
Yeah, please do. I would love to see that. I mean, I would, and if it becomes a proposal for us to take on as a group, as a part of what we're already doing around the COVID-19, you know, work. We spent a lot of the first part of this year doing advocacy directly to state legislators and to federal legislators, but state legislators specifically around COVID-19 and Black folks in California. Part of that campaign, though, is not just advocacy; it's also organizing and education on the ground too. And it's also mobilizing our community through education and through that organizing. So I'm definitely interested in that. You know, I was going to ask, and I don't know if you guys want to sort of have any comments on it as we welcome in Friday. Why do you think that is that their tests are available, but we don't see us testing? Like, why do you think that is? Are we scared of the test? I know I was a little bit hesitant, you know, at first, but like, what do you think it is?
The people that I've spoken to about going to get the test, they're just really not interested unless it's a test for antibodies. They just don't see the point, I guess, in getting tested just to tell you that you don't have it, and then, you know, as soon as you leave, you can contract it. And I told them what you said before in this meeting, what's been said before in this meeting. At least you have a benchmark from when you may have contracted the virus if you get tested, and then 2 weeks later you test positive, and at least you know that, you know, within that 2-week span you were negative and now you're positive, so you have a better idea where you may have picked it up. But a lot of people just are not seeing the value in taking the test if they aren't testing for antibodies.
Yeah. Chad, no, thank you for that, Kim. Chad in the chat here says we distrust hospitals and the U.S. healthcare system, which has historically been racist and dangerous for ADOS. And Martine is agreeing, and I'm agreeing too. I mean, there is a built-in distrust. It's part of I haven't done a lot of the PTSD sort of work, and like I don't know a lot about Dr. Joy DeGrew's work, but something about this resonates with me in terms of what I've heard her say, right? And so there is an aversion, there's a mistrust deeply of the healthcare system, and yeah, definitely got to check out her lectures there. And we're talking in the chat here saying there's lots of confusing info out there too. Absolutely. Lack of knowledge. At first, testing was only for those who were symptomatic, some not aware. It's available for everybody now. Absolutely. And that's from Akila. Marcus is saying, we got to get the book Medical Apartheid. That will probably give you the exact reasons why, right? So I wanted to point to something too. I had the good fortune of helping to produce this Thursday, I think it was Thursday or Friday, the 10th annual Black Physicians Forum here in Sacramento. Was done online, so I helped produce the live stream and the video. It was done by SAC Cultural Hub. I'm going to find the video in a minute and pop it in the chat for you all. But it's a special specifically about Black maternal health, COVID-19, and that conversation too. I think we want to lift that conversation up as well, right? And in the conversation around testing and treatment, that's something I think we want to also be lifting up very, very much here. We had some amazing, healthcare professionals who are on that call. And thank you to the healthcare professionals who are here today, on the call with us. Martine, who's working with us in Sacramento, I say she has the best job in the world. She delivers babies for a living, black babies, and so, I definitely want to lift that conversation up up to. And yes, and there is a PDF online too, by the way, that you can sort of check out. So I just want to make that point as we're rounding out this COVID-19 conversation. Any final thoughts on the COVID-19 work before we jump into the ACA 5 work?
Oh, yeah, it's Josiah from the Bay.
Hey, yes, and thank
Hey,
you
what's
too,
going on,
brother.
fam? Oh, yeah, for sure. I was just going to mention, based on my experience, from working at a medical center as well, a lot of people that I know don't like the tests that they're currently doing. And so, they don't want nothing going in the back of their throat through their nose. Like, they don't want nothing to do. And so I'm just saying, from actually working there, that's what everybody talk about. Like, man, I ain't about to do that. Like, have them digging in the back of my throat. And that was actually from, some of the nurses as well. And secondly, so like from my family, I think because sometimes they don't feel sick, even though they understand, that it can be passed, even though if you don't feel it, and everything, they still just they want to stay away, from it as far as possible away. So anyway, that's just based on my experience.
There's more than one test. There's actually, that I know of, there's 3 tests. There's the antibody test, and if you go to Harvest Fund on Facebook, they have been doing the blood test in Northern and Southern California. I got the blood test done 2 weeks ago for free. The other test is the gum swab, which I also did, and that was free through LA County. So we definitely need to be sharing that there is more than just the nasal swab, but the most important thing is the health. And then a broader issue is we need to start declaring racism and promoting that racism as a public health crisis. And we need to start getting funding for that from our state Surgeon General, who happens to be Black, and also from our federal Surgeon General, who also is Black and possibly ADOS. So this is a broader issue, but the feds have money set aside, and they've given, I don't know, I can't remember what the number is. I believe it's $100 million to tackle the crisis with, why am I blanking? The drug crisis that's going on in the white community right now. So if we can get some,
Was it the opioid crisis?
Yes, with the opioid crisis. He is tackling the opioid crisis. That is what he has been tasked with. So if we can get racism in healthcare or wherever else declared that that is a health crisis, there's a possibility that funding will be put toward the Black community to tackle racism, and also from the state and from the feds. So I'm just making that as a suggestion that maybe that's something we should explore in the future.
Yes, thank you. I'm actually looking for that video right now as you're making that point, Cerise, because I think the health director was on this call on this Black Physicians Forum meeting this week. And as I let in Presidia, welcome Presidia from the Bay Area. I'm on Stack Culture Hub site right now. I'm going to pop the link just to the site, and if you scroll down, it's like the first video up there. So I'm not going to make too much of this, but I don't want to jam the connection either. But that's where you'll find the Black Physicians Forum that we helped produce this week. And you're absolutely right, Sharice. And then the question is, how do we operationalize that in terms of, a legal framework or legislation, right, and advocacy, right? How do we weaponize that fact that racism is a public health crisis? How do we weaponize that for our advocacy here statewide? And I think that's a question that a conversation that we need to come back to pretty much every week until we have an answer. Okay, and that's what I'm going to put on the notes here. Racism as a public health crisis in California. Okay, and I'd like to come back to this every single time that we talk about COVID-19, which is pretty much every week, because that's the approach that I think we want to take. Right, we want to take the approach that racism is a public health crisis, and you're seeing an expression of that in the 1 in 5 deaths that are Black, or the 10% of deaths that are Black here in California for COVID-19. So I want to
Chris,
Yeah.
I just want to say, unless we make it specific to us, it's going to be watered down and everybody's going to be crying racism. Anti-Black racism is a public health crisis.
Boom. Anti-Black racism, anti-ADOS racism. How about that? I'll raise you one. Okay. ADOS racism is a public health crisis in California, nationwide too, but definitely in California. But that's the approach that, in terms of the organizing approach, that's the approach, and that's the way that I think we want to think about it as organizers. And then we want to act from that way of thinking. And that's the kind of urgency that folks, I think, need to take. And so I wanted to wrap up the conversation on COVID-19, at least for